I'll be performing the physical examination. Hello.
Hello.
Hi. I'm going to start inspecting your face for symmetry, any discoloration, any lesions, any hair overgrown, and I don't see anything. Everything looks fine. I'm going to inspect your hair for any lesion, bumps, hair distribution behind your ear line on both sides and in the occipital area, and everything looks good. I'm going to inspect your arms and hands and the fingers for capillary refill, your legs, sole of your feet, and capillary refill on your toes, and everything looks fine. I'm inspecting your eyebrow, eyelash, eyelid, conjunctiva, iris, sclera, and lacrimal duct, and everything looks okay. I'm gonna check your sinus. Let me know if you have any pain.
No pain.
How about now?
No pain.
Okay. Temporal iris and your TMJ. Open and close your mouth. All right. I need you to close your eyes, wrinkle your forehead. Okay, smile, clench your teeth, poke your cheeks, stick your tongue out and move left and right. Very good. Now I'm gonna inspect your and assess your eyes. I'm gonna check for pupillary size. I'm gonna shine the light on the tip of your nose. Perfect. And I'm gonna assess for pupillary response, direct and concentric. Okay, very good. Now I'm gonna check for alignment. I need you to look at the pen and look at the wall. Look at the pen and look at the wall. And that's totally normal. The corneal reflex test, we are not gonna be performing today. We're gonna move on to the extraocular muscle movement. I need you to follow the pen just with your eyes, the movement that I'm gonna perform. Very good. Now I'm gonna perform the ophthalmoscopic examination. I'm gonna start examining your right eye. I'm assessing for red reflex, cup, vessels, macula fovea. Everything looks good. Now I'm going to inspect on the left side for the red reflex, cup, vessel, macula fovea, and everything looks good as well. Okay. I'm going to inspect your nose, the nose bridge, the tip of your nose, and I need you to close the nares, one of the nares, and smell. Now the other one. That I'm assessing the olfactory cranial nerve number 1, and it's intact. Okay. I'm gonna inspect your nose, and I'm inspecting the nares. I check the turbinates, the mucosa, no redness, no discharge, no inflammation. And I do the same thing on the left side. No discharge, no discoloration, no inflammation. Very good. I'm gonna assess the hearing test. I need you to close this ear for me. And I'm gonna say a word and you have to repeat.
Apple.
Okay? Now the other side.
Apple.
Very good. We're gonna perform the Weber test for lateralization. Let me know when you stop hearing.
Stop.
Yeah. Now we're gonna test the ring test. You let me know when you stop hearing.
Stop.
Are you still hearing?
Stop.
Let me know. Oh, stop. So that's a normal sign. Air conduction is longer than bone conduction. And we do the same thing on the left side.
Stop. Stop.
Okay, it's the same thing. Air conduction is longer than bone conduction. Very good. I'm gonna assess your ears, the auricle and the tragus. I pull up and move it to the back, and I'm checking for the membranes, the turbinates, the membranes and the malleus. There's no discharge and no perforation. Everything looks normal. Okay, no perforation, the tympanic membrane is clear, malleus, hand of the malleus, no redness, everything looks good. Okay. We're gonna also assess the lymph nodes. Preauricular, postauricular, occipital, temporal, submandibular, submental, superficial cervical, posterior cervical, deep cervical, subclavicular chain. All right, very good. Everything looks normal. I'm gonna assess the JVD. This extend your neck, okay? And I see the pulsation for the JVD right here. I'm gonna put in my ruler in the external angle. And this is 4 centimeters, is a normal limit for the JVD measurement. I'm gonna check your trach. It's midline, swallow for me. Very good. I'm gonna palpate your thyroid gland. I hear this hyoid bone, thyroid cartilage, cricoid cartilage. Swallow. I see the isthmus moving. I'm palpating the left thyroid gland, and I'm palpating the right thyroid gland. And it's movable, and it's normal. Now I just need you to move forward, and I'm gonna inspect your posterior wall. And no lesion, symmetrical. I'm gonna assess for tactile fremitus. Say 99.
99, 99, 99, 99.
Okay. And I'm gonna perform the inspiratory excursion. Take a deep breath. Okay. Now I'm gonna do the percussion. Okay. And now I'm gonna auscultate your lungs. Okay, very good. Now I'm gonna move it to the anterior portion, and I'm inspecting your anterior wall, and I'm gonna auscultate your lungs as well. Okay, very good. All right, now I need you just to lean forward, and I'm gonna assess your heart, the cardiovascular portion of our exam. I'm gonna auscultate your heart. Okay. Okay. Everything looks fine. Now you're gonna lay supine for me. in the bed. Okay, I'm gonna palpate the aortic, pulmonic, second pulmonic, left sternal border, epigastrial, mitral. First, I'm gonna auscultate with the diaphragm portion of my stethoscope. Okay, and now I'm gonna auscultate with the bell part of my stethoscope. For any S3 or S4. Very good. Move to your left position, left recumbent, and I'm going to also take to the bell with my stethoscope for any mitral regurgitation. Okay, and everything looks fine. Lay back lay on your back. With the bell of my stethoscope, I'm going to auscultate the carotid artery, renal artery, iliac, femoral. I also gonna assess the brachial artery, radial, femoral, popliteal, dorsalis pedis, posterior tibial. Now I need you to sit up, and I'm gonna palpate. You can sit up. I'm gonna palpate your carotid arteries one at a time, and I'm gonna auscultate with the bell of my stethoscope for any heaves or trills. And everything looks fine. And we complete our physical examination. Thank you.